and you walk out of class straight to your locker. 5 minutes. 5 minutes to get your stuff, 5 minutes to have a conversation, 5 minutes to get to your next class. You meet up with your friend and start talking about what you did last weekend and what you're going to do over winter break. The only thing that can cross your mind is finding the perfect gift for your mom. You can't decide between getting those sneakers she's been waiting for since forever and you finally earn enough money to buy them for her. Or that newsstand mixer to make those delicious smelling gingerbread cookies you've been waiting for all season long. As you're having this conversation, your friend interrupts you and asks if you can bring her a tube of toothpaste tomorrow. This question strikes you as quite odd, and you realize this, but of course she's your friend, so you continue on with the conversation and say yes, of course. Ding! The second bell, that's the warning bell. 1 minute to get to class. You both say your goodbyes as she reminds you to bring the toothpaste tomorrow, and you turn your backs for the rest of the day. The rest of the day goes on, and the dismissal bell rings. As you're walking home from school, the thought comes to you again. Toothpaste. It's almost Christmas time, and she asked for toothpaste. And this isn't the first time she's asked for something quite odd and what you would assume as basic necessities. A couple weeks ago, she asked for a bar of soap, and a couple months ago, she asked she could come over to your house to take a quick shower before an emergency interview, because of course her house is always chaotic, so it's difficult for her to get things done. But as you're just now putting all these pieces together, you realize there might be more to the story than you know. Life is completely different for everyone. And many times, people don't even acknowledge the fact that people you interact with every single day could be living a completely different life than yourself. Hi everyone, my name is Bhavya Bansal. I'm a 15-year-old junior from Middleton High School in Tampa, Florida. I'm a student, athlete, and researcher, and I find solutions to real-world problems. Today, I'm going to look at the issue of the aging gap in healthcare amongst Americans and share with you an idea to combat 3 major portions of health disparities faced around the nation. So, why is health disparities such a large issue? This is because living a happy and healthy life is so important for everyone, and it's their right. After all, what's better than that feeling of clean hair, a fresh look, and a full stomach? So let's talk health disparities. Health disparities can be described as the unequal differences faced and experienced in healthcare due to demographic characteristics, such as race, ethnicity, gender, geography, and socioeconomic status. These characteristics are also known as social determinants, factors that can contribute to an issue. Now, if we take a look to why these issues are occurring, we can look at 3 umbrella categories. The first one being lack of education. Typically, these people don't have access to the internet and have limited schooling and not much access to media or news coverage. So it's really difficult for them to get resources in order to bring them out of these struggles. The second umbrella category can be defined as financial support and making the right decisions. Sometimes families want to make the right decisions, but their financial backbone just doesn't support these decisions. The other option may be that they are financially supported, but they're not sure how to manage their funds. And this can take quite a bit of experience and time to set up. The final category is quite important, but oftentimes left out. And this is the feeling of social acceptance. In our society, we have 3 social classes: the lower class, the middle class, and the upper class. And typically, the middle class and the upper class tend to combine together, and leaving the lower class to fend for themselves. And this can be quite devastating to their moral support down in the lower class. Because they don't have the same support systems, it can make them very difficult to come out of situations that at other times in upper classes might be easier to come out of. Which is why we need to make sure that we are giving them all the support that we can. Next, I want to talk to you about a really important concept called equality versus equity. So equality is based on the idea of fairness and making sure everyone gets the exact same thing with no discrimination. But this idea is largely based on sameness. For example, let's look at these 3 kids trying to look over a fence. Here, as you can see, equality would say to give them each 1 box, as shown here. And you might think that's it. That's what equality says, let's call it a day. However, if we take a closer look, we can see that these boxes actually actually didn't help everyone. If you see the girl on this side, even with one box, she still can't see over the fence. And over here, with one box, she could see over the fence regardless of the box or not. So they may have gotten resources or not gotten resources that they may need. And so from here, we can see that equality doesn't work in every situation. Equality is only truly effective when everyone starts on the same playing field. But in life, because life loves to throw us curveballs, it's really difficult for everyone to start at the same place. And using equality, that just doesn't work in every scenario. Which is why we take a look at equity. Equity is the use of adaptation and making sure that the resources are distributed accordingly to people who actually need them. Equity would say to give these three people what they need in order to give them the same opportunity to look over the fence. So here, by giving the final girl 2 boxes, she can now see over the fence successfully. The middle girl with 1 box sees over the fence perfectly, and the final girl doesn't need a box, so she won't get one. And through this example, we can see that depending on where you are in the stages of life, using resource distribution appropriately to making sure everyone that has the same opportunity is the key in solving health disparities. Now let's talk about some statistics. 40% of Americans struggle to afford basic needs. This statistic was found in a study in 2018, so prior to the COVID pandemic. But with this, we look at a more recent study, which is done in August of 2021. 46 million people struggle to just afford healthcare services themselves. We can see that through the span of time, this problem is only increasing, showing us that this problem is not going to go anywhere. It's been there then, and it's here now, and it's not going to go away. So now let's look at the food supply. 30 to 40% of the U.S. food supply is wasted each year, just because the food may have a blemish or it doesn't fit the proper standards to be sold in a grocery shop. But this food is perfectly fine for people who are starving and are suffering from malnutrition. Many studies have shown that our planet has enough food to feed its entire population. Yet, every single day, people go hungry. And the issue relates to food distribution, which is a key component that needs to be utilized in order to solve these health disparities. This can be because of the lack of properly partitioning resources, which goes often back to the concept of equality versus equity. Now, let's get to the good stuff. SNE Health. We needed a way to create hubs in locations with large populations of people that might be struggling financially, and help to supply them with resources that they needed. So, my partner and I set to designing SNE Health Hubs. These were designed to be able to reduce the gap between the demographic challenges and allow areas of need to have access to the resources they need in order to live a happy and healthy life. It comes with a 3-step process. First, we need to identify locations where we have large populations of low-income citizens. Then we will start implementing these health hubs, which will consist of 3 separate but dependent units that will work to solve 3 portions of the problem, what we call SNE, Sanitation, Nutrition, and Education. So let's take a look at the Sanitation and Healthcare unit. As we can see here, it will consist of vending machines, and the first of the vending machines will be used to serve over-the-counter drugs and medications, basic things at a very, very low cost, in order to make sure that these citizens don't have to travel long distance to get the basic health care that they need. But by adding a small cost and putting them in vending machines, we can reduce the risk of drug overdoses and opioid crisis. Continuing with the trend of low cost, let's take a look at another vending machine, which will address hygiene and sanitation. This one will include masks, hand sanitizers, gloves, and wipes, due to the obvious conditions that we're living in today, but also feminine hygiene products, as well as toothbrushes, toothpaste, soap, shaving materials, hairbrushes, and basically anything you could need in order to live a clean and hygienic lifestyle. Now, when you come to the decision between fast food and healthy food, that decision often comes down to price and accessibility. Many times families want to make the proper decisions, but they might not be able to afford it, or it's just not accessible in that area. Which is why we want to dedicate a portion of our organization to providing healthy food at an affordable price, in turn reducing health issues. Many studies have shown that eating healthy and having a well-balanced diet and watching your weight can all help reduce health issues, So, if we can stop the problem at its root, which comes from a well-balanced diet and having access to plenty of natural antibiotics, such as turmeric, cumin, fennel, and basil, and many other things that we use in everyday cooking, we can help to build a strong immune system. This is where our nutritional unit comes into play. In order to keep money running in a cycle, our organization will work with people in the area to start farms on community land. Here, we will grow locally grown produce that is both fresh and at low costs. Then, in order to create a self-sustaining community, we will allow these people to sell and buy products at the nutritional unit, and our organization will play a key role in starting up these jobs and farms so that they can flourish even after the hubs have been made. In order to harness the power of resource distribution we talked about earlier, we will be looking with big produce transporters and growers in order to redirect the not-so-perfect produce to the health hubs to make sure that they're actually helping people and not ending up in landfills. By addressing this nutritional crisis, we can help maintain the overall health and reduce it from reaching to a point of no return. Now let's talk about the educational unit, as seen here. Our educational unit will consist of a large digital screen that will include programs and resources from government and local organizations to financially challenged citizens. By having all this information in one database, we are making sure that these people have access to this great deal of information without having to look through the internet and not being able to find these resources. We are also fixing the issue of lack of communication and information due to income. By stopping this positive feedback cycle, we are making sure and helping the communities to grow out of these issues. And by giving them proper education, they can work to relieving any healthcare issues before they get to a point where there isn't any way to solve them. And just as a point of clarity, these health hubs will only be accessible to those identified as financially challenged in order to track the effectiveness of our program. So you may be thinking, what are the ideas here? So this is what I want to leave you with today. This problem is real. Health disparities is real. And we need to find a solution together and start implementing those ideas. Us kids are the next generation, and it is up to us to find real solutions to these even realer problems. We need to put our heads together and use our passion, hard work, perseverance, and dedication in order to look for issues that not only directly affect us, but the people around us. I like to use this analogy, the red flag analogy. If a red flag is looking straight at you, many times it's invisible and you can't even see it. But for someone who's standing at a slightly different perspective, such as here or here, they can see that red flag perfectly clear. And a lot of times we miss the very obvious problems just because they're not affecting our particular social class. So it's really important to look at things outside of the box from a different perspective in order to realize that these problems exist. And it is up to us to find these solutions.